Welcome to the Healthy Chicago podcast. My name is Mervin Dino, and I serve as the Assistant Commissioner for the Bureau of Inclusion, Diversity, Equity, and Access at the Chicago Department of Public Health. I will be your guest host for today's episode, and today we have an entire conversation focused on Medicaid. We are recording from our studios in City Hall, and I'm excited to jump in. We've got two guests here who are going to talk to us about the fight to protect and preserve health coverage in our city, which is really important. And one of my roles actually at the health department is leading our health coverage and healthcare access work and working with people and partners just like the both of you across our city, Cook County, and the state to protect health coverage. So excited to introduce our two guests who are working to protect Medicaid in Illinois, Anusha Thotakura, Executive Director at Citizen Action Illinois, and Timothy Jackson, Senior Director of Policy and Advocacy, AIDS Foundation of Chicago. Anusha and Timothy, how are you doing today?
Doing well.
Thank you for having us.
Thank you for being here. We really appreciate it. Anusha, I wanted to start with you. Tell us about who you are and what your organization is doing today.
Thank you. Again, my name is Anusha Thotakura, pronoun she, her. I'm the Executive Director of Citizen Action Illinois, the state's largest and oldest public interest advocacy coalition. And here today, along with Timothy, on behalf of Protect Our Care Illinois, which is a statewide organization of healthcare providers, patients, advocacy groups, small business owners that want to protect access to healthcare.
Thanks, Anusha. Timothy.
Yes, thank you so much for having me. My name is Timothy Jackson, pronouns he, him, Senior Director of Policy and Advocacy for AIDS Foundation of Chicago, where we really work at the intersections of ending the syndemics of HIV and homelessness, and I'm proud to be a steering committee member of Protect Our Care Illinois, which is working again to protect access to Medicaid and healthcare coverage for everyone here in Illinois.
Thank you both. Really appreciate it. And so for our listeners who may not be aware, Medicaid provides health insurance coverage for millions of Americans. And obviously this is a podcast focused on Chicago. And just to give you a couple of pointers, in Chicago, nearly 1/3 of the city is covered by Medicaid. And we're talking about just under 1 million Chicagoans and impacts so many people in societies. You know, Timothy, you talked about the intersection of people who live with HIV and homelessness. Anusha, you talked about some of the role in terms of advocacy, and Medicaid impacts so many of us, from hospitals to schools to health centers and community organizations and our economy, which I know we're also going to talk about too. And so part of this is also very personal conversation because all of us know somebody who has Medicaid or is impacted by potential changes. And this is a topic that hits home for many people. Would you say that's accurate?
Absolutely.
Yeah, absolutely. So thank you for just the introductions here. And I wanted to walk us through the world of Medicaid. There's a whole lot that's happening. And I want to make it real clear that the Chicago Department of Public Health doesn't administer Medicaid, but something we are really concerned about is all of these different changes. And so my first question is, what's going on in terms of Medicaid, and tell us about the role of Protect Our Care Coalition in helping sort through these potential changes.
All right, so I can start us off. Congress is approving over $880 billion of cuts to Medicaid and SNAP. And so that's going to mean that 3.4 million Illinoisans, including a third of Chicagoans, who rely on Medicaid and SNAP for essential services, including health care and food, may not have access to that. People that have health coverage today may not have it next year. Their health coverage will be terminated because of the cuts that are being proposed. And just to put some numbers to it, a third of Chicagoans, that includes about half of kids in Illinois that rely on Medicaid for health coverage. About half of births in Illinois are covered by Medicaid, and 2 out of 3 seniors rely on Medicaid. They're dual eligible for Medicaid and Medicare, and they rely on Medicaid to cover their long-term care. And so all of those folks that depend on it for life-saving health coverage will not have access. And they're doing this to fund tax breaks for the wealthy. And for wealthy corporations, wealthy billionaires, that is why essential programs like healthcare and food benefits are being cut.
So we're talking about a really important benefit that's provided to people of this country, including people of Chicago. But a lot of people are going to be facing the consequences of decisions that are largely meant to benefit other people with more resources. Yeah. Timothy, what's your sense on the current situation? What comes to mind?
Yeah, I just kind of think about really where Protect Our Care has stood over the last few years. We were really created in 2016 during the first Trump administration to really push back on the harmful cuts that were described back then to Medicaid, as well as the repeal and replace efforts to the Affordable Care Act. And we understand, again, what is a healthy community? Here in Chicago, across Illinois. And obviously, you start there when you're talking about access to quality health care. And so essentially, our coalition, as Anusha mentioned, is really kind of a broad, diverse group of people around the state working to push back on these harmful cuts that are really going to impact so many of the communities that are already finding it very difficult to basically live their best lives. And so we're doing everything that we possibly can to push back on those efforts on Capitol Hill.
Yeah. And the both of you, of course, are not working alone.
No.
There's a whole coalition of partners. Tell us about these partners. Who are they and what areas do they serve?
I mean, anyone that works with the communities that rely on Medicaid and SNAP, whether you're a healthcare service provider, a housing service provider, you do workforce development, so many of our most vulnerable neighbors rely on Medicaid and SNAP. So a lot of the people that work with them directly on a day-to-day basis, even education providers like schools, churches, after-school programs, people care about having access to health care because when you don't have health coverage, that doesn't mean that you stop getting sick. Mm-hmm. That just means that you can't get care. And ultimately down the line, if your complication turns into something more serious or you aren't able to get preventative care, so you end up in the emergency room, that affects the entire community, not just from a healthcare perspective, but also from an economic perspective. It's more expensive to treat people when they get sicker. So we are working with all sorts of providers and people that care about this issue. Just this weekend, Protect Our Care, we have canvassers out in Rockford that are working to collect petition signatures to show the opposition to cuts to Medicaid and SNAP. We were at churches, we were at food pantries, we're out in the community, just in front of stores talking to people because so many are affected by Medicaid. It's more of a question of who doesn't care about these cuts, right? Yeah. Everybody does.
Yeah, and it's important also, too, that we remember that we're also working with federally qualified health centers. These community health centers that are really kind of ground zero for many communities where people can get care. And so we understand that these cuts to Medicaid that they're proposing on Capitol Hill, if they go through, they're going to really be very harmful to these community health centers, in turn our communities. And so people are not going to be able to get the preventative care. It reminds me of something my grandmother used to say, an ounce of prevention is worth a pound of cure. Mm-hmm. And that's essentially what we're going to be looking at, that you're going to be rolling back vaccinations, HIV testing, all these different things that are really critical to making sure that people lead healthy lives.
Yeah, and the bottom line is that people are going to need care.
Yes.
And you mentioned some of the impacts on people, and then Timothy, you're also mentioning the impacts on the providers that care for people. Yes. And Medicaid is impacting a lot of people in society right now. And so lots of changes. What I hear you all saying is there are lots of changes. People are working on the ground to oppose those changes, and that these changes don't just impact people, but also the providers that serve these people. So there's a lot that's happening in terms of what's being proposed. And I think if someone is checking the news about what's happening around Medicaid, they will see a whole lot, probably more than they ever have. And Timothy, you talked about first Trump administration, Trump 1.0, and then now we're in Trump 2.0. And back then it was repeal and replace. This is a whole different situation. And I'm wondering if you both can talk about why is this situation different from what we saw in 2016? Maybe Anusha could start with you.
Yeah, I think that things are moving too fast and too far. This level of changes in the first just few months of administration, this is nothing like what happened last time around. Yeah. And when you make decisions this quickly and this drastically, you end up hurting a lot of people who are really vulnerable, the most vulnerable in our society, because you're not thinking through the impact that this is going to have on folks. So there's this, message of, fraud, waste, and abuse. What we're really talking about is people who rely on Medicaid for essential health coverage that will no longer be able to have that access. So this level of speed is really concerning. The drastic level of cuts is really concerning. And I don't think anyone actually opposes looking at fraud, waste, and abuse. No one opposes that. But what people oppose is taking away their health access to pay for tax breaks for billionaires. And that is what's happening under this guise of looking at fraud, waste, and abuse.
So there's almost like a facade.
Yes.
And a lot of this has been perceived very, very differently. And when you get deeper into the details, and you actually can see what the real impact's going to be.
Yeah, I would just kind of add this is really kind of same script, different cast from 2016, 2017 Trump administration. Whereas you can't just look at this in a vacuum, that these are just $880 billion in cuts to Medicaid. But when you look at that coupled with the $230 billion cuts to SNAP, when you look at these harmful executive orders related to DEI and gender ideology, or when you're thinking about the hollowing out of the CDC, the FDA, and the HHS, and so you're thinking about all of these things together, and you're really looking at, again, how do we create a healthy community? How do we keep that going? You can't do that when all of these things are rushing you at once. We're not even 100 days in yet, and we're still now having to push back on all of these things, not just the $880 billion cuts to Medicaid.
Yeah, and it's beyond overwhelming. And as you said, it's about the speed and also just how many changes are happening at once. It's not just about these cuts, but then also about every single action. And
Yes.
and for those who are working on the front lines to protect Chicagoans, it can be really overwhelming. And even just for myself, I have to sit with news, process them, look at news at my own pace and peace because there's just too much that's happening. And I'm also learning a lot that just the knowledge of the network is more important than the knowledge of a single person. And I hear from you all that the coalition is working together. So there's a lot of scenarios. I think there's a lot we don't know at this point. But we do know is that this is on the table. And we also know that there's potentially some truths that we have to really decipher around what actually Medicaid does to benefit society. And also, I think people can find common ground that we don't want waste or fraud or abuse, but that information shouldn't be misconstrued in a way that actually is deceptive to people. So totally understand that in terms of the policy specifics. And I know this is, of course, more of a policy conversation. I think for those who are listening, it can feel really complicated. But I'm wondering if you can take us through what are some scenarios that you all envision that you're tracking right now. And I think all of us are holding our breaths around what could potentially happen. But what is one scenario that you're really watching for right now? Maybe Timothy, I can go to you.
Yeah. Obviously, one of the things that come to mind to me is Illinois is one of 12 trigger states, which basically means there's a state law that says that if the federal match for the Affordable Care Act, expanded Medicaid, falls below 90%, which means that the federal government pays 90%, the state pays 10%. That if it falls below 90%, that all the people that are on the Affordable Care Act, expanded Medicaid, would lose their coverage within 90 days. That's over 770,000 Illinoisans. And so obviously that is something that is top of mind to me, that as they're talking about these $880 billion cuts in Medicaid, obviously changes to what we call the FMAP, the matching rate, is something that is important to me.
Yeah.
Another story that I'm thinking about is, one of the things Congress wants to do with these cuts to Medicaid is impose work requirements, which on the surface level, may not seem as controversial to some folks. But the bottom line is that in order to work, you have to be healthy enough to work. And it's not even clear about the exemptions that may exist for people with disabilities and seniors and other folks, that there's a reason that they may not be able to work. And a couple weeks ago, we had a press conference with a podiatrist that shared her experience working with folks who are on Medicaid and how she treats many folks. She's based out of Rockford, Illinois, the Rockford area, and she treats patients who may work on factory floors. And if someone sustains a foot injury that causes them to come in for treatment, and what she prescribes is someone staying off of their feet for a prolonged period of time, they may not be able to work, right? If your work involves physical labor and you have to take time off of work to get your healthcare treatment, that may not be possible for you to have a work requirement to continue to get your health coverage. And if you lose access, then you're going to continue piling up your medical debt as you continue to get the care that you need. So work requirements do not work. And that is one of the big changes that we could see coming down the pipeline. And so it's important that people know, first of all, that if they are on Medicaid, what it may be, because a lot of folks that have Medicaid may not know. They may know that they have health coverage, they filled out some forms, they're able to get that treatment. And so one of the really important things that the Protect Our Care Coalition is doing, that Timothy's team at the AIDS Foundation of Chicago is leading, is storytelling and story collection for people who are on Medicaid to share, without access to this health coverage, I would not have been able to get XYZ treatment. And that really helps us put names and stories to the numbers that are also really, really important.
Right. It's almost as if we don't need more evidence to say that Medicaid work requirements don't work. We need the stories.
And that is absolutely so true. What I like to call is coloring inside the lines. I mentioned that if this trigger law goes into effect, over 770,000 people would lose coverage.
Yeah.
That's 770,000 Illinois families or seniors or disabled folks. And each one of those data points, those are families, those are households that have stories. And so if we're able to really kind of pull together some of those stories that really, again, color inside the lines and provide some weight to this policy, I think it's going to do a tremendous help in our efforts to really push back on everything that's happening on Capitol Hill.
Yeah. And I know there's so much work that's going into to help humanize the issue and rehumanize it, because clearly this is about people. And we always say that public health is about people, and clearly this is going to impact so many people. You talked about 770,000 people across the state. We've found out those numbers for Chicago, which is around 230,000 Chicagoans. So the impact is really severe on this. And I know that there's a lot of, I think many of us can go into this doom and gloom type of mood when we talk about situations like this. I do want to highlight some of the work that's really happening. I think you both have talked about how you're working on the ground and you're partnering across coalitions and organizations that traditionally you may not be every single day. And I was wondering if I can just ask you, what is really giving you a lot of motivation around partnering with people on this? Like, how are you working together in these moments?
So, what Timothy was sharing earlier about all the different issue areas or sectors that are expecting these cuts, coming together in this way helps us identify like a story of an individual person, like a mother that may send her child to Head Start. Head Start is getting cut. She may also rely on SNAP and Medicaid. Those are being cut. She may also rely on federally funded housing. That is being cut. So the same people are getting hit in so many different ways. And it's not just like one population. You might think of Medicaid as traditionally for people with low incomes. But as we discussed, a majority of our seniors rely on Medicaid to pay for long-term care. We did an event in Marion, Illinois, which is in southern Illinois, a couple weeks back. And we had folks from a bunch of different areas, including the Carbondale Warming Center, which is a homeless shelter, Task, which is a healthcare provider for folks who are facing incarceration and need substance abuse treatment. They hosted us in their office. We had U.S. postal workers join us and a Head Start provider. And I've never done something across all those different issue areas before. I think if you see that in writing, you're like, that's kind of a random group of issues to get together. But throughout that roundtable conversation, the concerns really surfaced of every single community is going to be hit. Rural communities are going to be hit the most for sure. And you may think of, for example, the Postal Service as not being something that you may think about every day, but people rely on the Postal Service for their medications. And the common theme is that we're taking away services to pay for tax breaks for billionaires. The Postal Service may be privatized so that we're treating the Postal Service as an industry that will only focus on lucrative service areas and not areas that may still need access to delivery, mail, medications, things that come through the Postal Service. So bringing us all together, we can reach more folks, right? We're talking about storytelling, contacting your legislators. All of that can happen at the numbers that we need it to happen when we're working with people that we may not traditionally work with.
Yeah. Yeah, Medicaid, benefits so many people. I think both of you talked about that. And the intersection of all those issues is really important, too, because not only is it benefiting people with low incomes, it's people with disabilities, persons living with HIV, people experience homelessness. The list really goes on. And these changes impact all of us. So it's not just those who have the benefit. It's everybody. It's people who may not even know that they're contributing to the issue are going to be impacted too. And I think the tagline of Medicaid work requirements don't work is a really important one to help fight through some of the surface level. This is what sounds good as a policy, but when you dig deeper into the details, you realize there's more to it. So I appreciate you sharing all of that too. And Timothy, I wanted to, you do a lot of work, of course, with the AIDS Foundation of Chicago. And I did want to ask you, and then of course, Anusha, hear from you as well, is in times like these, there's so much uncertainty. And people may be concerned, and especially those who are hearing this, and they're likely very concerned about what's happening with their health care, what's happening with their provider, can they still see them, what's going to happen. So how can communities find support and resources? Where would you direct people to?
Yeah, there are a couple of ways. One, excuse me, obviously reach out to Protect Our Care Coalition. So you can go to our website, protectourcareil.org, for resources and ways that you can get engaged in the process. One of the ways that I would also encourage people to do is to reach out to their alders. They're oftentimes a great resource for connecting them to local services on the ground to be able to get them the support that they need. Also, reach out to their state senators and state representatives. Again, very much like the alders, they can also link them to all of the services they need, especially as we kind of, again, push back on these harmful cuts to Medicaid and to so many other different things that touch this, whether that's SNAP, whether that's housing, whether that's, a myriad of other different things that we've talked about. And so, yeah, I think all of those would be great options.
Anusha?
I would say same, and that right now there's still time, right? There's still time to slow down what's happening in Congress. There's still time to oppose and push back, and that's how we're doing the work that we're doing, because we believe that we can fight back and make sure that a year from now we're not in a position where people are really scared about having lost access to their health care and not knowing where to go. So for folks that are listening and may have the bandwidth to do something to prevent us being in that situation next year, join us for an upcoming event. Like Timothy said, protectourcareil.org. Join us to write a letter to the editor. We'll help you think through some talking points, share your story. We'll help you record your story and share it with other people. There's a lot that can be done, and I think people need to know that they can use their voice, their experience, their story, and they may not know how important it is because this affects so many people, but taking that extra step to share your story takes a lot of bravery and courage, and it resonates with people, everyone from, your peers, your neighbors, but to members of Congress as well.
Absolutely. And so as we get closer to our conclusion here, I want to ask a question more at a personal level. We just talked about a very, very overwhelming issue that overwhelms, us as people trying to oppose the changes, and then also people who are impacted in our communities as well. And so tell us, what keeps you going in this work? Timothy or Anusha?
Well, I think just having come off a weekend where we were in Rockford and doing some in-person organizing and talking to people who are both personally impacted by the issue or just care about the issue of having access to health care is that this is not just a short-term fight. Right? Wherever we end up a year from now, 2 years from now, we have an opportunity here to engage people who have never thought about the importance of having access to healthcare or never felt it threatened before. And that's what we can use to have conversations, to organize, and to build momentum for expanding, not just preventing cuts, but expanding access to high quality and affordable healthcare. And I see a lot of momentum right now because unfortunately people are paying attention that haven't paid attention before. I mean, that's a good thing that now people are paying attention.
You've got people's attention.
Yes, and I think there's a lot of opportunity for us to continue to build those relationships and grow our movement.
Yeah. Timothy?
Yeah, I would just kind of end on kind of a personal note for me. One is I remember growing up where my mom was a single mother working, often relied on Medicaid for health care for my sister and I, often relied on food stamps for my sister and I in our household. And so I couldn't imagine these families that are in Chicago or around the state that could potentially be impacted. I also think of my late grandmother who one of the misconceptions around kind of in-person care is for those that are aging, our aging population that would potentially have Medicare. But if they're in a nursing home, that's paid by Medicaid. And so just understanding how important that was for the last few years of her life to be able to have that lifeline. And so essentially what these $880 billion in cuts to this is really trying to cut the bottom out of the safety net for so many communities across Illinois. And so that's the reason why we do the work that we do.
Yeah. Thank you. And it's a safety net that's already been ruptured, and we need the stories. We also need people to take action. I am inspired to hear that there are people who are waking up at this issue before it actually impacts them. And we do need to get in front of this issue. And I'm glad that you've had a lot of the movement on the ground. Very glad to hear of the momentum. And so just before we wrap, I want to first thank Timothy and Anusha for being here today to just walk us through what's happening in the world of Medicaid, and also just for your fierce advocacy during this time. I know these are very tumultuous moments, and so thank you both for being here. And before we wrap, just want to lay out a couple things to our Chicagoans and everyone listening. So Chicagoans who potentially lose coverage through health benefits for immigrant adults and other changes that are happening at the federal level will still be able to receive primary and preventative care through federally qualified health centers. We talked about community health centers and the safety net today, in addition to free and charitable clinics, which serve individuals who are uninsured and underinsured, regardless of immigration status and ability to pay. Very important for those who live in Chicago and Cook County, you can call 211 or text your zip code to 898-211 to get connected to a resource navigator for health and social services. 211 is a free, easy-to-access helpline. Really recommend it. It's so easy. You just dial 211. And for mental health resources in particular, we know that this is a big need in our city. You can visit chicago.gov/mental health clinics to find a mental health provider in your neighborhood. And lastly, please consider sharing this episode with at least one person to hear more from Anusha and Timothy. Conversations like these are so crucial to taking action. So thank you for tuning in. Stay steady, everybody, and be well.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.